Hello and welcome to Mother Care. My name is Mary and it's always a pleasure and privilege bringing the show to you. Thank you for all your questions, your comments and all your emails. We truly appreciate it. And of course, that means you have to stay with us for Doctor on Demand to see which of your questions we're going to answer on the show today. Today on the program, we'll be doing something really important. It's cervical cancer, and I do hope you stay with us from now to the end of the show. We'll start off with our mini feature that explains a bit about the topic, and when we come back, we'll be talking to real women on the streets on this real issue. It's Mother Care. Stay with us.
There is an ailment which prevents mothers from seeing great moments in their children's lives, their graduations, weddings, great promotion at work, and seeing their grandchildren. Every mother's dream. This disease is cervical cancer. Cervical cancer is 100% preventable when detected early. If allowed to progress to the stage of full-blown cancer, it becomes very expensive to cure and highly devastating in presentations. Worldwide, one woman is killed every 2 minutes by the viral disease. World Health Organization says 630 million people are currently infected by the virus which causes cervical cancer. It is the human papillomavirus HPV which destroys tissues around the cervix, commonly referred to as the neck of the womb. Women are expected to take interest in knowing their status from the age of 18, but more especially from the age of 25. In Nigeria, one woman dies every hour of cervical cancer, and every year, a total of 8,000 women in the country die of this sexually transmitted ailment. Despite this reality, only 1% of the women population in Nigeria understand what cervical cancer is and how to ensure its prevention. To see that women are made aware and prepared to stay safe from this highly dangerous, slow-killing disease, steps are being taken by the National Cervical Cancer Prevention Program to help women detect this curable cancer early. The organization says the first major and wisest step for every woman to take is to ensure she is screened. Findings reveal women's reluctance to go for screening is responsible for the high incidence of the cancer. To curb the spread of this disease, coordinators of the National Cervical Cancer Prevention Program have been sensitizing religious bodies, the media, and civil society on the importance of early screening. Doctors say screening for cervical cancer is better done when a woman is not menstruating. If there is an existing vaginal discharge, she should first see a doctor for proper treatment before cervical cancer screening. To ensure the protection of the lives of the nation's women, the National Cervical Cancer Prevention Program is calling for the support of the government, corporate and religious bodies, as well as kind-hearted individuals.
Welcome back to Mother Care. Now, what do real moms out there know about cervical cancer? How does it affect them and even their daughters? How does it affect childbirth? What is the situation when we get on the street? Are we informed? Let's get all these answers and more.
Cervical cancer? No. Do you know you have to do a test? No. Do you think it's important that you should do it? To me, I don't think that it's necessary.
Welcome back. You're still watching Mother Care, and it's time to talk with our doctor in house. I'm talking to Dr. Femi Olalaye, and today it's something really, really, really important. First of all, I'm going to say thank you so much for being a part of Mother Care today.
Thank you. Yeah, thanks for having me.
Oh, it's always great to talk to you. Now, the focus today is cervical cancer, and yes, a lot of people are thinking, really? Well, really, I've been talking to Dr. Femi for a while, and I am amazed about the facts and the information about this topic. But first, Doc, let's start with the basic. What exactly is cervical cancer?
Thank you, Marian. Cervical cancer is cancer of the cervix, and the cervix is the neck of the womb of a woman. Every woman has a womb, and every womb has a neck, the outlet, basically. And it does a very simple function, the cervix. It allows the menstrual flow of the woman to come out every month. It allows sperm to go in. So that fertilization can take place, and then 9 months later it allows the baby to come out because it has to open up, and the baby comes out. And after the baby has come out, the afterbirth has come out, the cervix closes again. When daddy is busy making the phone calls, we've got a baby and all of that, the cervix is closing again, and it had better close. Otherwise the woman will have some other complications later. We'll come and talk about that on Mother Care later. So that is what the cervix does. So cancer of the cervix is cancer affecting just that area.
Okay. Wow. And that does all those three things.
Yes.
Now, how does cancer? How does that happen to the cervix? How does cancer get there?
We didn't know this before, and thankfully, recently we've now discovered. And recently, maybe about 2-3 decades now, that there is a virus that's implicated in causing cervical cancer. And that virus is called human papilloma virus, HPV. And like all viruses, you can't see them. Like most viruses, you can't eradicate them. But more importantly, unlike most viruses, this one causes the cancer of the cervix. Like the common cold virus, it doesn't cause any cancer, but we can eradicate it, but we can't cure it. That's why we don't have a cure for the common cold. HIV doesn't cause cancer, but we can't even cure it yet, and we can only reduce the impact of it on the immune system. But for cervical cancer, the impact of this virus in the woman can be prevented.
It can be prevented.
And that is the beauty about talking about HPV. So when women hear HPV cancer, they should remember this is a cancer that can be prevented on our genital area. So how do we acquire this virus? Before I even go to how do we transmit it? We usually acquire this virus. Most people acquire this virus as boys, little children, running around, playfully skipping around in dirty water, in areas where they could have been exposed to the one form of germs or the other. And this virus stays in the body of the man, particularly around the groin area, and becomes what we call a normal flora, a normal organism on the genital area, but it doesn't do anything to him. Just like our mouth. Our mouth has a normal flora. And how do we get bacteria into our mouth? If you see a little child pick up anything, what are they going to do? Put it in their mouth. That's how bacteria got introduced into the system in the first place. So don't be amazed that little boys have bacteria around their genitals as well. Now, it doesn't do anything to them. It doesn't do anything to us, the bacteria in the mouth, unless we don't brush. Then they multiply. So because we wash daily as well, we reduce the amount of the bacteria and the germs in our genital area, particularly HPV. And it doesn't do anything to us until we make love to women. And it's not protected through condoms. So a man is not protective. So imagine because it's your groin area. So the man comes along, happy-go-lucky. Woman says, "You're welcome, my darling," and they have copulation. The man basically introduced the virus to her, and as you know, there's a whole lot of exchange going on during the sexual activity. The man will come back again and again and again, and therefore push it even further into this woman, and the woman will be asymptomatic for years. In fact, if that is not our only sexual partner, she's happily distributing it to other sexual partners. That's why HPV is the commonest sexually transmitted virus in the world.
Wow.
And sadly, a lot of women don't know this.
Okay. Now, Doc, you say she can have it for a number of years. How long?
Statistically, we know before the virus can change the cervix to turn to cancer, or scientifically, I should say, it takes about 3 years minimum.
Okay.
So, and I will explain why this knowledge is very important to prevention. So, we would recommend that women should know about this and checking their body 3 years after they started become sexually active, because anytime from 3 years up to 15 years, the virus can be in the body of the woman, quietly changing the cervix without giving her any symptoms. And this knowledge, like I said, has been around for decades. So developed countries have designed their healthcare delivery system to inculcate regular screening for their women, so that they don't discover when it's too late, which sadly is happening to a lot of mothers at home.
Okay, so now the point is, every woman who is sexually active is at risk.
Yes.
Is at risk. So what can we do?
3 things women must do. The first one is what we're doing right now: raise awareness.
Okay.
It doesn't cost much to tell another woman, have you heard?
I'm telling you.
That's the first thing. Women must tell women, and therefore the job you're doing, the job I'm supposed to do, will be a lot easier. Because if women know that they're at risk of something, they will demand the next thing, which is screening.
Okay.
Once you become sexually active, which I believe every woman who is desirous of having children would at one point or the other get involved in, then 3 years down the line is their time to start.
Okay.
I cannot legislate what age people become sexually active, but you can have an idea. 3 years, I'm 25, I'll be married next year, 29 is my age.
Okay.
Or you were sexually active at 16. So, and you are 25 now, you are overdue. Or you are a mom in your 50s, you've never done screening.
You don't overdue.
You don't even have intercourse anymore, maybe because you're a widow, or something has happened to your husband, or you don't have intercourse anymore. You are still at risk.
At risk, okay.
Or now I am born again, I'm a Christian, I don't do things like that anymore, but you're in your 30s and you did things like that back in university, you are at risk. So everyone is at risk.
Okay.
And 3 years is the minimum longest duration you should leave your intervals between screening. Because a woman could come for screening this year and her cervix is fine. And remember, scientifically, we have discovered that it could take 3, 4, 5 years before the changes can show. So that means your next screening should be less than 3 years. So that if we pick it up this year, or we didn't pick it up this year, we can pick it up the following year. And then the third thing women can do is taking vaccinations.
Okay.
Because scientifically, again, we've discovered this thing is caused by a virus. So it makes sense to go back to the lab and say, well, can we develop a vaccine against this thing? And yes, we have a vaccine.
Wow.
Just like we have a polio vaccine, we have a measles vaccine, we now have a vaccine for HPV. Now, how do we give it to women? We can give babies the vaccine. We've discovered that we can actually give young girls from the age of 10 the vaccine. And it makes sense. If you give a 10-year-old the vaccine, she completes the doses of the vaccination within 6 months. She has immunity for life. So when she becomes sexually active in her 20s, and the gentleman comes along with his "I love you" and with his ulterior motives and with his HPV, she can take the love and the gifts and say, "Thank you very much, thank you very much. I don't want that."
Okay.
And the immunity will be so high.
Is that readily available?
It is now. Again, they call us a developing nation for the reason because we're developing. In developed countries, they already achieved 70 to 80% vaccination of all their girls.
Wow. Okay, look, I wish I could go on forever, but the good thing about Dr. Femi is that we're going to keep on having him, on the show, and he's going to give us more education. But look, I know I'm supposed to be passing the message just like you, but I have been taught so much, and having a daughter myself, I'm calculating how many years more before she's got to have it. I don't have to go through, what a lot of us have to go through eventually. Thank you, Doc. This was so amazing. It was nice talking to you.
You're welcome.
And all the information you gave across. And of course, we're going to have you more on other days on Mother Care. Thanks again for being a part of the show. We're going to take a short break, and so much more on Mother Care. Stay with us.
Cancer is the world's leading serial silent killer, and everyone agrees that it needs to be stopped. Currently, it is reported that it kills 4.2 million people prematurely per year, aged 30 to 69. In Nigeria, records show that 1 out of every 11 women will have breast cancer, and 85% of them will die due to late presentation. By its activities, cancer continually erodes the productive workforce in the country, especially among the women folk. This is why Skybank, as a responsive corporate citizen, teamed up with Care Organization for Public Enlightenment, COPE Foundation, to celebrate World Cancer Day, a day founded by the Union for International Cancer Control, UICC. The World Cancer Day is marked every February 4 to support the major goals of the World Cancer Declaration written in 2008. The day is set aside to raise mass awareness about cancer and to encourage its prevention, detection, and early treatment. This is aimed at significantly reducing death and illness caused by cancer by the year 2020. This year, the focus is to dispel damaging myths and misconceptions about cancer under the tagline, Debunk the Myths. These myths are: we don't need to talk about cancer. Yes, we need to talk about it. There is no sign or symptoms of cancer. There are warning signs and symptoms. You just have to be vigilant to notice them. There is nothing I can do about cancer. A lot can be done effectively if the disease is detected early. I don't have the right to cancer care. Everyone is entitled to effective cancer treatment and services. Skybank, in her determined and people-centered corporate stance and as part of our social responsibility initiatives, has taken up the gauntlet in the campaign to eradicate this silent killer called cancer in Nigeria. As such, she has outlined the following deliverables in this direction: sponsorship of over 30 indigents for cancer treatment.
It was in furtherance of our commitment towards contributing to the fight against the high incidence of cancer, especially breast cancer, in the country, that we partnered with an NGO known as Care Organization and Public Enlightenment, COPE Foundation, under our corporate social responsibility initiatives, by donating 2 breast cancer screening machines to it to facilitate screening and early detection of the disease.
The bank has also dedicated 3 mobile telephone lines through which members of the public can learn more about the cause of cancer, its prevention, control, and treatment. The telephone numbers are 081 3710 9164, 081 80 0004, and 0809 344 3223. The GSM lines will be manned by a team of consultant oncologists and clinical radiologists spread across university teaching hospitals. These lines will, at the expiration of the special corporate care period, revert to COPE Foundation, and members of the public can relate with the foundation on their subsequent information needs on cancer. We at Skybank seize this opportunity to celebrate the World Cancer Day and thereby fulfill United Nations Global Declaration of Prevention, Early Detection, Treatment. Skybank, expanding your world.
welcome to your program, Doctor on Demand, and of course in your segment in Mother Care Program. It's nice having you back again today. Thank you for keeping a date with us, and thanking everyone who has made it possible for us to be here, sending your text messages and of course your email messages. We received all of them. Like we have always promised in this program, we try as much as possible to ensure that we tackle the questions. Please, doctor, I noticed a lump in my armpit and a change in the size of my breast. What can I do? She noticed a lump in her armpit and a change in the size of her breast. What can she do? Lump in the armpit, this actually should ring a bell if you actually have been following us on this program. Lump in your armpit is it like a seed? Most times, is it a lymph node? If it's a lymph node, it's a sign that something is happening. There's an infection going on around that area. When you feel something like a seed in your lump beside the ear, most times it's when you have an injury or when there's an infective process that is going on. Now you have a lump in your armpit and you notice that there's an increase, there's a change in the size of your breast. Is it painful? Is there any tenderness? Is there something like a boil? You need to look at that. But then, we won't take any chance here. Lump, change in the size of your breast, you need to see a doctor as urgent as possible, as soon as possible, because it might just be something that is coming up that we are not even sure of. For instance, if you have the cancer of the breast, if you have a tumor of the breast, it's very, very possible to have that swelling and or the change in the size of the breast, and also to have a lump around that area. We need to investigate it. When you go to the hospital, they will check that lump that you have noticed. They will take a small sample and be sure that it is a safe lump. Any lump that is available needs to be investigated. Then secondly, another question is, Doctor, I'm happy with your program. Oh, thank you very much. Kindly help me. My breast is itching. Why? You're happy with our program? Yes, we have to tell you thank you. And of course, without you, this program won't be possible. And my breast is itching. Why? Your breast is itching. Do you have any rashes around that area? Do you feel any warmth? And is there any swelling? Or is it just itching? You need to exclude all these things to be sure that there's no warmth to touch and you don't have rashes around it. Then also, your own personal hygiene is also very important. Then the kind of brassiere that you actually wear. Is it nylon? Is it cotton? Is it new? Some people react to nylon, and some people are just okay with cotton bra. But if it's none of those and it persists, then you need to also see a doctor. Then the other question is, please doctor, my nephew has symptoms of autism. Please refer me to where he could get treatment. We actually tackled autism in our program, in the main segment of Mother Care. We tackled autism. And I'm sure it's in response to that, that is why this person is asking where they can take the child to. We'll try and get back to you through your cell phone and send you to where you can actually have care. We'll just expect a message from us. We'll send you a response where you can actually take care. Otherwise, you can go to the nearest hospital, the government hospital around you, the nearest one to in your locality, to seek help at the pediatric unit. So same time next week, we'll be back again on Doctor on Demand. Ensure that you keep a date with us. Keep sending me the text messages. Of course, keep sending me the messages via our email. Thank you so much and have a very blessed evening. God bless you.
Well, today has been amazing. I mean, I have been informed. I can't believe there's so many things that we can do to prevent it. In fact, I can't believe that men, you guys are the reason why we're here, but can't do without you. So I guess we have to prevent the issue. But really, it's so important that we know what we ought to do. Let's be informed. The facts and figures are amazing, and the fact that something easy, as simple as vaccinating a girl child at the age of 10 can actually stop all of this how many years down the line. And then for those of us who have missed the vaccination, it's time for us to go out there to get screened. It is so important. Get a screening center near you and get screened. It is very important. Thank you so much for being a part of Mother Care. I always say it's a pleasure and privilege. And remember, being a mom, it's the best job.